Good morning, everyone, and thank you for tuning into WHLI Health Talk. I'm Dr. Victor Politi. I'm the president and CEO of New Health. That's the Nassau University Medical Center over on Hempstead Turnpike in East Meadow. So, as healthcare in America is changing, New Health is part of that change. So, this half hour program will provide you with some essential information about our services, our facilities that provide top quality care that fits into your lifestyle. So, as you know, Nassau University Medical Center is the county's premier level 1 trauma center. And a lot of people think of Nassau University Medical Center, they think of emergencies and they think of trauma, and they think the helicopters landing there bringing really sick and injured patients from across the country or across the county actually to the hospital. But in reality, we have so much more to offer the community. We have full service, state-of-the-art centers of care. We have the A. Holly Patterson Nursing Home Center, and we have Long Island federally qualified health centers throughout Nassau County to provide primary care to the patients. So Nassau University's medical center really has gone over the last couple of years over a big change. It's no longer the Meadowbrook Hospital that people came to know it as years ago, but now it's a new, dynamic, changing environment. Some of the best board-certified doctors and nurses, really expanding programs, a lot of education. It is a university hospital. We have residencies and fellowships, all sorts of training going on, as well as having some of the top doctors in Nassau County. So we want people to know that Nassau University Medical Center is changing, that we're there, we're in your community, we're more than just trauma. And to give that information to you, we have this show. And I bring in different physicians and different types of people from the hospital to talk about the different things that we're doing there. And today we definitely have an honor to have one of our obstetricians and gynecologists here, Dr. Bryson, who will talk to us a little bit about what's going on in our OBGYN department. I mean, really, we just received, this is true, right? 5 stars from a national, health grades organization that rates hospitals, and this is our 3rd year.
This is our 3rd year receiving the GYN Service Excellence Award.
GYN Service Excellence. So people don't realize here in right on Hempstead Turnpike, right in East Meadow, here in Central Nassau, that we have a service excellence for OBGYN to have your child either in prenatal, see the obstetrician or deliver the baby, or just for your gynecologic needs. And we're going to talk a lot about that over the next, half hour about all the different things that we provide. But I know for a fact, and Dr. Bryson will tell us that the labor and delivery unit is brand new. And really, if you're in there, you'd think you're in a 5-star hotel. I mean, that's how nice that area really is. So why don't we start off, let me introduce Dr. Bryson. Why don't you tell us about yourself, where you went to school and your residency and that type of stuff, and sort of let the listeners, find out what really a great doctor you really are.
I'm Dr. Lennox Bryson. I did my residency at Nassau University. I completed my medical school education at New York Medical College. I've been at the medical center for the last 15 years working as a board-certified OBGYN, training residents, which has been an amazing experience. We've produced many of the OBGYN physicians on Long Island have trained right at our program at Nassau University Medical Center. And it's a pleasure for me to be here to discuss comprehensive women's care here on Dr. Politi's show today.
Yeah, and you really do bring a lot to the table, Dr. Bryson. Your training, your expertise, your years of experience. I know for a fact your patients love you. I see them all the time. I read the letters of compliments that they send to me as the CEO of the hospital regarding, what you do in the hospital, and the patients that you see, they really do love you. So
it's a pleasure to serve the people who can afford and the people who have insurance. And for me, I take pride in helping out people who wouldn't normally be able to get care. Mm-hmm. And I think it shows in everything that I do because I'm diligent on taking good care to patients.
Yeah, and that's true. You have all your private customers, your private patients, and yet you go way out of your way to help anybody who is uninsured or patients that don't have any type of other coverage. You lend all your services to those patients as well. So it really is a tribute to you as a person, as a doctor, that you do a lot of that as well. So.
And it's also a tribute to the hospital to be able to enable me to provide that kind of care. Mm-hmm. So it's excellent, and I'm fortunate to work in a place that can provide service to everyone.
Yeah, and Nassau University Medical Center is that place. I mean, it back in the day it had a reputation. People sort of felt that, all right, why are we going to the county hospital? I mean, I want to go to a private hospital, and it's no longer the county hospital. Separated from the county, and now we're a public benefit corporation, and we're distinct from the county, and we have a board of directors of notable people, and basically, since I've been there, we've been bringing in some really great physicians, some board certified guys. Whether we're talking about cardiology, where we're going right now, building our second cath lab. So it's a center of excellence for cardiology. I mean, we received a gold award from the American Heart Association for stroke. We have some of the top board certified neurologists there, and we received a American Heart Association gold award for stroke care. We have one of the best CAT scans on Long Island. I mean, you come in, we have a 320 slice CT machine in the emergency room. So, someone's coming in with a stroke, we have a stroke code, just like we have a trauma code. If someone's coming in with a stroke, EMS, the ambulance lets us know. We activate the stroke code. We have neurologists, we have neurosurgeons, we have neuroradiologists, and we clear the CAT scan for that person. So not just, OBGYN, but just across the continuum at Nassau University Medical Center, every single week, every single month, we're changing and building something new. We have a primary care, as you notice, downstairs. $24 million primary care, which will provide OBGYN services for your patients in a private office setting. It's very brand new. It's going to be nice. It's going to be opening up in the summer. It's going to be really airy, nice, painted bright colors, and it'll have great doctors like yourself there.
That's going to be amazing when that opens up, because it's going to be able to bring my whole department in the ambulatory setting under one area. And having that kind of access to have your sonogram and to see your doctor and to have a high-risk consultation if you need it right there all in one spot is going to be amazing.
Yeah, and people need to understand that they're getting the top doctors. These are the doctors that would be at other hospitals, but they're here with us, and they're board certified and at the top of their game, and we're looking forward to that. I mean, so that's like $24 million we just spent in the primary care. The ER was $38 million. We just finished with that. And we have a state-of-the-art emergency department, and we're moving new ICUs, new CCUs, orthopedics. A lot of people wind up into the hospital, no pun intended, by accident. They'll have an accident, and the EMS guys in Nassau County love Nassau University Medical Center. We're their hospital, and that says a lot for the hospital, that the primary care, that the first responders consider it their hospital, and they bring their patients to us because they know they're going to get good care. So they have a car accident, they come in, they have an orthopedic emergency, they get admitted to the hospital. All of a sudden they say, wow, this is NUMIC? I never knew the hospital was so nice. I didn't know the nurses were so good. Even the food is good. I mean, we eat in the cafeteria every day, and it's the food is good. So, I mean, people tell you the floors look like you could comb your hair on the floor. It's so clean. So, and I'm very proud of that. And it's not me. It's the people that work there. The people who work there really take pride in that facility. So what else is going on in OB/GYN? Let's talk about a little about women's health. Let's talk about primary prevention and some things that every woman listening and pay attention, because this is life-saving stuff, ladies, that is so important. Gentlemen, if your wife is a little nervous about going in for their tests or they're because that's what happens. You get anxiety. I don't want my breast exam. I don't want my pap smear because I'm afraid about what I'm going to find. But the key is to detect this stuff early. And why don't you tell us about that?
Prevention is the key. We recommend that women get their pap smears yearly until they make sure that they've had normal pap smears. Then they could change the interval according to the American Cancer Society guidelines to every 3 years. Women should not get pap smears until they're 21 years, and that's a new change. So that's something very important for everyone to know, that you should not start getting your pap smear until you're 21 years old. And in terms of the follow-up after that, the human papillomavirus is the virus that's caused the biggest cause of cervical cancer. And it would be great if we get this word out to the community that the Hpv vaccine works and saves lives. So we should basically encourage everyone over the age of 9 to start getting that vaccination.
Just say 9 years old.
From 9 years old,
get that HPV vaccine.
Yes.
And they've determined that's what HPV is one of the causes of cervical cancer?
It's the leading cause. Over 90% of cervical cancers are caused from the human papillomavirus.
It's very important. And you don't have to be sexually active. We should get them at 9 years old, correct?
That's excellent. You're supposed to be naive to sex, so you shouldn't have had a sexual experience to make sure that the vaccine works.
And it's so important to prevent cervical cancer because that is one of the leading cancers in women.
And it's preventable.
And it's
so
preventable.
that's
Wow.
really great. Although the Pap smear is one of the most amazing tests that they've come up with, prevention is better than taking care of something. So I encourage everyone to get their HPV vaccine for their children. It's not going to give them any side effects or anything that would harm them. So I encourage.
I mean, it's easy for me as a man to say, listen, ladies, you got to go to the gynecologist.
Right.
But I know, women, they become very anxious. They're nervous because they got to be undressed, they got to be in the table, and they have a strange, person. Hopefully hopefully they know you and have a relationship with you as a physician. But is it painful or is it uncomfortable?
That's an excellent point. As you said, Dr. Pillity, most women, when they come to their gynecologist or obstetrician gynecologist for an exam, they're very nervous. And they do all things to prepare themselves, but the anxiety still is there. And I think if you have the right approach to your patient and you could develop a little bit of a rapport with them, that could put them at ease. And having someone else in the room sometimes to assist with everything that you need also puts patients at ease. The pelvic exam doesn't hurt. It's really, and the Pap smear doesn't hurt. It's more about the anxiety of going through an exam. That's probably worse than the exam itself.
Right.
So, if you can get the patient to relax, then you would really get a good result. And the patient, it only takes less than a minute or two to do a Pap smear and a pelvic exam.
Yeah.
So the anxiety,
so
is
important.
there, but it's so quick and it's very, very important.
Yeah.
And we have other screening tools that are very important. The Pap smear is one of them, but cancer screening for the breast through mammography is the next big thing. And Long Island has a lot of breast cancer, so everyone needs to know that they have to go out and get their mammograms yearly once they get to be the age of 50. And over
Is
the
that
age
the
of
number
40,
now?
over the age of 50, you need it yearly, and over the age of 40, you need it every other year.
Every other year.
Yeah.
So if you're 40 years of age, you should start getting your breast mammograms
Yes, you
at
should
40.
get at the age 40.
So
unless you have
a family history?
a family history of breast cancer, then you start earlier in your 30s.
In your 30s. So,
Yeah.
but any women in general, no matter what size breast, small breast, large breast, they benefit from mammographies every other year at 40.
Yes.
And then every year at 50.
Yes.
Now, we at Nassau University Medical Center, we have a mammography suite. Beautiful place on the second floor, all redone, fancy, carpeted, the whole bit. And we have, more importantly, what they call a tomosynthesis machine for mammography, which is the state of the art. And it's gotten a lot of accolades in the literature that we can pick up very, very, very small lesions. So what's the benefit of getting an early mammogram, and what's the benefit of using NUMIC's, Nassau University Medical Center's new state-of-the-art tomography? Is there a tomosynthesis?
Well, the benefit is that the technology, as you just described, Dr. Pillity, is very new. Everyone doesn't have that. So prevention, as we said early in the program, is the key to everything. So the more technology we have, we should use it to basically prevent and help people, who could be suffering from
So if we
conditions.
do a mammography with our machine that we have at NUMIC, and we find a very, very small lesion, are we able then to get in there, and are the odds greater that we can we can prevent this from spreading, prevent this from becoming a disease?
Early detection in any condition is the key.
Okay.
Is the key to
Right.
it, because we can't prevent things from necessarily happening, but the sooner we find out about them, and between mammography and tomosynthesis, that gives a woman a great chance of surviving her cancer with early detection.
And that's what we're all about. And in Long
And that's
Island,
what-
is there a higher percentage? Are we a higher incidence for breast cancer here on Long Island?
There definitely is a higher incidence of breast cancer on Long Island. So the women of Nassau and Suffolk and Long Island need to really make sure that they go for their screenings.
I mean, and that's so important. So let's just, we go into the gynecology. We have a gynecologist. We have specialists. We even have gynecologic oncologists and
Yes.
specialists as well on board. and God forbid you needed some breast augmentation or breast reconstruction, we have some of the best surgeons. We have the Long Island Plastic Surgical Group. I mean, you're not going to get better than a Long Island Plastic Surgical Group in Long Island. And listeners don't really even realize this, but at Nassau University Medical Center, the Long Island Plastic Surgical Group is in that hospital. They're in there 24 hours a day. There are burn doctors. They're available in the emergency room for people that have stitches that say on their face or on their legs. A woman, they're very cosmetic, and they're concerned about those appearances, about scarring. I mean, the lips are there. And they also do breast reconstruction, and so we have this services available. Hopefully, we get them early enough. We are able to treat them. But if they do have to have a mastectomy, we have some of the best breast reconstruction.
And that's key. It's a traumatic experience to have to deal with cancer, but knowing that after you have your cancer, you can have your breast reconstructed and have a normal appearance after that is
Right.
really reassuring, because a lot of body image, of course, problems arise from having,
Sure.
your breast removed.
And
But-
we're not on the radio show to scare women, and I'm sure right now, so just talking about this,
Sure.
I'm sure it makes people very, very nervous because, oh my God, that's like horrible. But it's so important, because if you get to us early, and I'm not, we want to do the right thing, and we want you to come into the hospital or go to your doctor. It doesn't even have to be Newark. Just go see a gynecologist or your mammography, and make sure you're taking care of yourself. Because look, if everybody was healthy and the hospitals were out of business, we'd all be happy. I mean, I'll find another job, but it'll never happen in our lifetime. But if we can cut back on the severity and the deaths associated with these things, that's something that we need to
Prevention
do.
is the key.
Yeah. So we do that. How about as far as other gynecological services before we talk about obstetrics? Anything else that you could think of that we have going on at
Sure.
Newmick?
We have an amazing colposcopy center where we evaluate patients from all over Nassau County who have abnormal pap smears. So if they have what we call cervical dysplasia, abnormal cells in their pap smear, we do a colposcopic evaluation, which is basically like a microscope, and we take a close look at the cervix, and if we see abnormal areas, we evaluate that through biopsy, and are able to give the patient a better idea of exactly what's going on.
Amazing. Breast exams for women, self-breast exams. Is that something they should do in the shower every morning?
Self-breast exam is an excellent thing. No one can know the breast better than the patient herself, and if she does take the time to do her own examinations on a regular basis, she will be able to find something. if
Something
it's there.
small.
Yes.
But that does not replace the mammogram. The
No.
mammogram will pick them up
No.
even smaller than you could feel them,
Exactly.
which is
Nothing-
key.
That's just that's just another tool to assist us. Self-breast exam, but mammography is the screening test that really helps save lives.
So do you deliver a lot of children?
I deliver. I've done a lot of deliveries, so much that I can't count over the last 19 years. And it's an amazing experience to bring children into the world. And, the emotional aspect, for me, I do it all the time. But for the family, that would be something that they experience once or twice or three times in their life. And it's just, you can't even describe the emotions.
Yeah, it must be a
that come
great
from
feeling
that.
on that.
Oh, it's
see
an
that family with that
amazing
baby.
feeling. Everyone involved is elated, and it's a great thing.
Yeah. How's Newmick for obstetrics? How's our labor and delivery and all that
Newmick
stuff?
just opened up over a year ago a brand new state-of-the-art modern facility that almost looks like a hotel. It's bright and airy, and the patients just love it. The rooms are large. It can accommodate many family members to be there if that's what the patient wants during her birthing process. So it's amazing.
So the L&D, the labor and delivery area now, I noticed it. When I got here, we had the ribbon cutting, and it's all beautifully, open, wooded, and nice bathrooms with showers. And the woman will come in labor.
Yes.
She'll go through her labor in that room, and she'll deliver in that room as well. So
Yes,
it's not
she
like you're
will.
moving her from one room to the next.
That's an excellent point. The patient does her labor, delivery, and recovery in the same room. And then after she recovers, then she'll go over to the maternity ward.
And I thought when I walked into the room, I thought I was in a hotel room. There's a bed, there's couches, chairs, there's wall paneling, and then all of a sudden you hit a button and the walls spin around, and there's all the electronics and the
Yes.
oxygen and all that other stuff, and then you hit another button and a spotlight comes down from the ceiling like an operating room. I'm like, wow, this is like a beautiful hotel room, and all of a sudden it turns itself into an operating room if
Yes.
needed, a labor and delivery room.
Yes, so it's very functional. It appears as if you're in a hotel room, but you can get everything that you need to help the mother and the baby in that
Amazing.
process.
And and if someone's thinking about having a baby or are pregnant and they want to look at the hospital to see the lady, could they come and take a look at it?
Oh,
Could you
we
arrange tours with them?
encourage anyone who's interested in having their baby at our place to come for a tour. We're available to give tours just about all the time, as labor and delivery is a 24/7 operation.
Yeah, I mean, you have someone in labor now, right? Is there
Yes,
some?
I have one of my private patients in labor now.
I know, because you said you have your beeper, and if the beeper goes off, you have to run out of the interview. That's
Yes.
okay. I could talk I could talk by myself for a half hour.
Yes.
You know, but
Yes.
that's great. So you have your labor and delivery all ready to go. Then you have your postpartum area, your child nursery, and
Yes.
we're a level 3 NICU
Yes,
nursery.
we are. So that we can deal with preterm or premature babies because of that nursery status.
Yeah, because we have one of the highest, most critical care nurseries. So God forbid something goes awry, something problem that you have on 24 hours a day, 7 days a week, at least one or two. Even during the day, we have like 3,
Neonatologists.
board certified neonatologists
Yes.
standing by to help the obstetrician. God forbid something goes wrong.
And teamwork is key.
Mhm.
Everyone's there to pitch in and give
Yeah.
a hand.
And you have your own operating rooms there
We
as
have
well.
our own operating rooms as well.
Yeah, so like a lot of hospitals share the ORs for these types of things, but we have our own full operating room anesthesiologist right there, right through the doors of the labor and delivery.
Nassau University's Department of OBGYN Women's Service is a comprehensive place that provides all service: anesthesia, neonatology, pediatrician, obstetrician, gynecologist, everything.
Everything,
We're a
right?
full service hospital for all of our patients.
And people
needs.
don't know this. I mean, they think, hey, what kind of hospital? It's this county hospital. They have no idea what's going on in that 19-story giant building on
Yes.
Hempstead Turnpike. It really is.
It's an amazing thing. Another thing that we have as it relates to labor and delivery is we're the only hospital on Long Island that has water birthing. Um, um,
What's
A
that?
water birth.
What the heck's a water birthing?
A water birth is basically when the patient will have her baby in basically a large tub, and the baby will be delivered in the water. So it's called hydrobirthing or water birth.
So you're pregnant.
Yes.
I'm in labor. I come into New Health,
Yes.
National University Medical Center. You put me in one of those really nice rooms,
Yes.
and I'm there, and you're monitoring me on all those monitors, and everything's really cool, and the baby's doing great. Only now I'm, dilated. I'm effaced. I broke my water. Imminent delivery. What do you do now?
I deliver the baby.
You deliver the baby.
So-
You make it sound so simple.
Essentially, then we would set up the patients in her room, and we'll set up the room as you described earlier, which is set up to accommodate anything that we have to do, including the delivery right there in the room.
How about the water birthing?
So the water birth, what we do is we would get the patient inside when she's at least 6 centimeters dilated, and you have to be 10 centimeters to have the baby. Once she's 6 centimeters dilated, we put her inside of the tub, and we let her have the labor process there. Once she's ready to deliver, she actually relaxes herself as much as she can, lays back, and pushes the baby out in the water.
Baby comes. So now this baby is underwater.
The baby is delivered underwater.
So, like, does he have a snorkel? I mean, what goes on? How
No,
does he?
the
How's he
baby
not?
doesn't have a
He's not
snorkel.
drowned. I
We
mean,
let
I don't get
we
it.
let him or her, take a little time, and we gradually bring them up out of the water.
On the water. And I mean, I went to the opening of the birthing unit the
Yes.
other day with some of the midwives, and they had a lot of patients that actually came back for the opening
Yes.
with their children, and they were just speaking so highly of it.
But the birthing center is an amazing experience for people, low-risk patients who want to have a more relaxed environment with minimal intervention, medical intervention. So as long as they're healthy patients with no problems, we say that that's perfectly okay for them to have that kind of experience and to have the people involved with them that they want. And water birth is a natural process, and any patient who is a low risk patient can have that experience.
So so it's not for everyone.
It's not for everyone.
So you need to be examined by the gynecologist and cleared for a water birthing.
Exactly, Dr. Politi. You do have to be cleared by obstetrician gynecologist to have a water birth.
If you had if you had a prior C-section, a cesarean section,
Yes.
are you still able to do a water birth?
No, you shouldn't do a water birth.
That's one
with
of the
because we have to watch you and make sure that there's no other problems.
Okay, so that's one of the relative
Yeah,
contraindications
that's
to
one of the
this.
and any infections or any medical problems that would make you a high risk pregnancy. So it's
So-
really for low risk women
Right.
who don't have any medical problems and no infections, and they can do that.
And so now you're in the tub. It's a giant hot tub.
Yes.
And you're sitting in this giant hot tub and you're in labor. And women are telling me that they're not having the bad contractions. They're not having all the pain. Although I'm sure it's not pain free. I'm sure it's always a lot better after the child, after something's over. I'm not sure if we asked them during labor if there's any pain. They'll say
You're
that.
right. Well, what it does is water has a calming effect, and for some women, just to be in the water relaxes them. And in terms of contractions, most of the women who want to have a water birth study relaxation techniques and really try to have a natural birth, so they know that they're going to be in pain, but they have things that they could do to try to alleviate that pain, and having the support of their midwife or OB provider there with them helps them, and they're really motivated. The key is in everything else in life, when you're motivated to do something, you really try to focus.
I think when you're 6 centimeters, you're pretty motivated.
Dr. Politi, you're right. You're definitely motivated, whether you want to be or not.
I got news for you.
Yes.
So now the baby comes out in the water, and
Yes.
and you gently lift it up,
You gently lift it up
and give it to the mother, and the baby is.
It's fine.
You cut the umbilical
And
cord,
we cut the umbilical cord like how we would if it wasn't a water birth, and place the baby on the mother, so we have skin to skin immediately, and it's a beautiful experience.
Oh, what a great thing!
It's a beautiful
Again, and I went up there, and sound like a broken record, but that's adjacent to the labor and delivery that we just talked about.
Yes.
And this was we just cut the ribbon 2 weeks ago, I think,
Yes,
on this,
it's-
and this is brand spanking new, and the rooms again look like
Brand
you're in a
new,
hotel.
state of the art rooms. You'll have an amazing experience if that's what you decide.
Yeah.
to have.
Again, this one it looks like a hotel room with a hot tub next to the bed.
Yeah, this one actually looks like a suite because
Yeah.
this is its own area with the lounge area with 2 birthing rooms.
Yeah. So, any advice for some of our ladies out there, whether they're pregnant or not, as far as their overall GYN and obstetrical health?
Well, first I'd like to say is that at Nassau University Medical Center, we provide comprehensive women's services to women of all ages, and regardless of their ability to pay. And as we said earlier in the show, prevention is the key. Everyone should come for yearly exams, and we encourage patients to come once they find out that they're pregnant as early as they can, because we have a lot of early interventions that we could do to diagnose if there's anything wrong with the baby.
It's absolutely amazing. And, you're doing a great job, Dr. Bryson. I know all the doctors that we have in Newmark, all the obstetricians really are like yourself, are very caring people who really give of themselves to their private patients, and also are there for us in emergency situations as well as patients that come to our primary care center and our FQHCs, the Qualified Health Centers, which we have 5 of them throughout Nassau that also are related to us. So anyone who was interested in Dr. Bryson or in our hospital in any regards, whether they need a mammography or a pap smear or anything, we could be reached at one phone number. It's a 516 area code, 486 NUMC. So 486 NUMC, 486 6862. 6862. Or you can get www.newhealth.net. That's a website, www.newhealth.net. And once you get on that, you could pull up this show, and they have all sorts of things on there, interesting stuff about the hospital and some information. And you just call up and make an appointment and come see us. And, we'd love to take care of you. We love to work with you and keep you healthy, because that's what we're all about here. So, really thank you all for listening. Dr. Bryson, I can't thank you enough for being here.
Thank you, Dr.
I could go on for another half hour with you about a million questions I have about all these cool things. But the primary takeaway is, ladies, take care of yourselves. We need you around. The families need you around. Your young girls, you need that HPV shot. And we need you to be here healthy. Your family needs you, so take care of yourself. So, anyway, Dr. Victor Politi, I'm the president and CEO of Nassau University Medical Center on Hempstead Turnpike, really changing the face of healthcare. It's really an amazing place with everywhere we go, every floor, we're just changing the whole place around. So, I just want to wish everyone a great day today. Stay healthy, and we will be here when you need us. So, thank you. Goodbye.